Alright, so we're talking about hamstring strains, and in this video I'm just going to be talking about phase one, the phase one recovery process of getting back to sport and back to activity. So first of all, before we get into it, I just want to sort of reiterate and mention that it's really important that you be sort of doing this process with a healthcare practitioner, whether it's us or someone, or a physio or a doctor or someone else, just because it's really important that you recover correctly, because up to like 1/3 of people who have injured their hamstrings will re-injure them within the first year of returning to sport. So you just want to make sure that you're doing the best job you can to prevent that happening again and having a longer recovery process at that time. So phase one, our goals for phase one are to protect scar development. So we want to make sure that we're protecting the area so that we don't re-injure it and tear more muscles, or tear what's the tissue the scar that's being laid down to sort of patch that up. And we want to minimize atrophy, which is we don't want to totally avoid movement and then end up with totally weak muscles. So we want to still have some kind of movement in there, but not too much that it injures the healing process. So first of all, you've got your PRICE guideline, which is protect, rest, ice, compression and elevation. So protect it, so just taking care of it so you don't like re-injure it, don't bump it, don't overuse it. Rest, again, you're resting, so allowing the recovery process to kick in. Ice, you're using ice 10 to 20 minutes on at a time, once or twice throughout the day as needed, preferably keeping that within the first 72 hours, because beyond that it can actually impair the healing process, but just using that as you need and checking in with your healthcare practitioner around that. Ice compression is you can sort of wrap your hamstring with a bit of compression bandage or something if you feel like you need it. Elevation is obviously keeping it elevated so the circulation doesn't pull in that area so much. So those are your basic kind of like guidelines for immediately after the injury. Then you want to gradually start incorporating some gentle movement. So throughout this whole process, you're going to be using pain as your guide. So if you're doing anything and it's painful, or you do something and it's painful like a few hours or next day after, you've done too much and you need to regress and do a little bit less, because you don't want to be re-injuring and delaying your healing process. So gentle exercises, just like walking around, or on like a stationary bike with a very low resistance, just getting some movement through there, getting some circulation through there is important. And then I'll show you a couple of simple exercises. So I'm going to cut to another video here and show you a few simple exercises that you can do to sort of get a little bit of movement through there and help with the healing process. All right, see you in a sec. All right, so sample exercise 1 is just a very gentle leg swing. So the idea of this one is you're just trying to get a little bit of movement through the hip and the hamstring, but you're making sure not to push the range of motion, or you want zero pain in this kind of movement. You're just getting some blood through there. So it helps if you've got like a little base to stand on, so that you can really just let the swinging hip relax, so that if you try to do it without it, your foot's going to kind of be like brushing on the ground, which is okay, but it's a little bit more better if you've got something like that. So I'm just going to stand on that. You can do it next to a wall, so you can brace the wall for balance. Don't fall over, don't hurt yourself, please. And then you're just going to swing it. So you're just going to set yourself a little timer, say for a minute or so, and you want to try to do this like 3 times a day. You can do it at different times throughout the day, so you get the benefit of it each time you do it. And do that on both sides, because this will also be so it's good for getting movement on the affected side, but then when you switch and do it on the other side, it's going to be a stability exercise for the affected leg. Now, obviously, if it's too painful, don't do that, but yeah, just work within your limits. All right, next, we're going to start incorporating some balance exercise into your rehab. So First of all, ideally you'd be doing this next to a wall where you can reach out and balance if need be. But first of all, you're just going to start. Can you stand on one leg for 20 to 30 seconds with your eyes open? And then if you can do that easily, you want to then close your eyes. If you are reaching out and grabbing something, you want to make sure that eventually you're just working up to maintain the whole time without eyes closed, but just regressing it to where you're at. So that's the first simple one, and you can do that like four times throughout the day for 20 to 30 seconds each time. You could even just do this while you're like brushing your teeth as well. It's an easy one. Make sure you're doing both legs as well. You want to make sure that you've got even balance side to side, and you also want to know like, okay, this is my injured leg, this is where it's at, but this is where it should be getting up to, and at the same time you'll be sort of working up the other leg. You can progress that a little bit more if you're feeling a bit more adventurous. So the next progression would be standing on one leg, and this time you're doing some movements. So touching forwards and backwards, side to side with one leg, and again working up from eyes open to doing it eyes closed. You're touching side to side. It just adds that extra layer of difficulty. All right, and so for the final sample exercise we'll give for you for this phase is a side step. Now there's many variations of the side step. This one is just focusing a little bit more on stability. So essentially you're going to have your feet about shoulder width apart. You're going to sort of bend down a little bit, so you get a bit of a bend in the knees, and then you're going to step out one side at a time. So stepping out to the side like that, and your weight is over this side. You're only just a little bit of weight for balance on that leg, and then again changing, other side, and you're kind of stepping out. This foot is about in line with the heel of the other foot. You're just doing it sort of slowly in this phase in the beginning, really focusing on your form and control. But you can increase like the speed and intensity as you're feeling better. Again, use pain as your guide with all of these exercises. Don't push through anything, don't re-injure it. Make sure that you're progressing nicely. With this one, you're looking to do 10 reps and do that 3 times throughout the day. All right, now I just want to cover how you know when you're ready to progress into the next phase of exercises and recovery. So first of all, you're working with a healthcare provider, so when they say you're ready. So yeah, make sure that you're working with someone and you're progressing at the right stage. But also you're looking for, can you walk without pain? Can you walk up and down stairs without pain? And then can you even go for a very short, gentle jog, like just accelerate a little bit without pain? So we're looking, those are the kind of things that your practitioner would be looking for, and you'd be looking for to know that you're ready to sort of progress into some more advanced exercises for the rehab. Anyway, check out our next video because we'll go into all of that.